name is Danielle and I'm here today to execute a persuasive speech about cosmetic surgery. My sources were from many diverse articles from the SIRS database. My audience members are Julie, Shannon, and Melissa. And my cameraman. Cosmetic surgery adversaries and enthusiasts debate over the risks and benefits of cosmetic procedures. A sharp rise in the popularity of cosmetic surgery would lend to the beliefs of the enthusiasts. Adversaries oppose cosmetic procedures, claiming that the risks outweigh the benefits, while enthusiasts claim just the opposite. And scientific studies have proven that human beings are hardwired to respond more positively to beautiful people. We like, trust, and value them more, this lending to the increasing popularity of cosmetic surgery. Cosmetic surgery can have health benefits and be worth the risk in the long term, if made with an educated decision. Cosmetic surgery adversaries believe that there are underlying health risks with most cosmetic procedures. These adversaries believe patients who have cosmetic procedures are at risk for mental illnesses such as BDD, body dysmorphic disorder, or imagined ugliness. Also, women are at risk of developing cancer through things such as silicone implant leakage. However, with any type of surgery, there are risks, but usually in the presence of these risks are benefits. Cosmetic surgeries such as breast reduction for overly large are recognized for their ability to lessen a woman's pain. Studies have shown that the link between breast implants and cancer along with BDD have proven to be inconclusive. Challengers of these supporting cosmetic surgery have claimed that because cosmetic surgery is not always long-term, it is not worth the risks and it may come with these procedures. Though many of these procedures are not long-term, like breast enhancement, they may be beneficial to certain people. An underdeveloped woman would possibly continue to get her breast redone simply because she would look better in her clothes, which would withhold value in the long term. Women who deal with the periodic upkeep of breast implants have a higher level of assurance that their breast implants are not leaking, leaving them cancer-free from implants. In many cases, cosmetic surgery is long-term and beneficial. Cosmetic procedures used to correct things such as birth defects or tragic scarring are examples of long-term procedures. A child who has a cleft lip will benefit from cosmetic procedures throughout their life. After being separated, Siamese twins can receive cosmetic surgery to enhance their appearance for a normal life. Also, a person who has been tragically scarred from a fire or accident may benefit from procedures such as skin grafts. Although these procedures may take several surgeries to find the outcome is permanent with no upkeep. Though against these procedures have stated that men and women who receive medical procedures for cosmetic surgery are more prone to depression and suicide and should not receive surgery due to its addictive state. They profess that many patients who underwent cosmetic procedures became disillusioned, with the results leaving some profoundly unhappy. Under normal circumstances, cosmetic surgery will boost a patient's self-confidence, therefore leading them away from depression and suicide. However, those who do become addicted 9 times out of 10 had an addictive nature to begin with. Many individuals receive cosmetic surgery to better their lives and feel better about themselves, while others do it for the attention. There are those who undergo cosmetic surgery for the sake of a reaction, and when the reaction wanes, they receive more surgery in the hopes that attention will return. Although many people receive cosmetic surgery to boost their self-esteem, there are no proven underlying issues of clinical depression or addictiveness. The risk of depression, suicide, and addictive state are all based off a person's level of self-esteem and varies from person to person. For some patients, self-confidence is provided through cosmetic surgery. Self-confidence for some is as simple as increasing their breast size, allowing them to look and feel better in their clothes. Someone who has small breasts and has breast enhancements can shop confidently, knowing that clothes will fit them. Patients who receive cosmetic surgery will be happier and their whole lives will be changed. Women who feel insecure with their bodies, shying away from wearing bathing suits and low-cut clothing, will have a high self-esteem after breast reduction. Patients who receive cosmetic procedures will be able to perform everyday tasks with a higher level of self-confidence. People with unappealing features, such as characteristics in the normal process of aging, are looked up on as undesirables in the workforce, therefore being targeted as unhireable or downsizable. Many people are seeking a fresher, more energetic look to be more appealing in the workforce, leading them towards cosmetic surgery. As workers are faced with the largest layoffs and worst job market in recent history, plastic surgeons are saying that while the recession has hurt the overall business, they see sharp increases in the numbers of nervous women and men coming in for Botox injections, eyelid lifts, or neck tucks as part of an aggressive strategy to stay competitive with youth in the roughest employment market in a generation. Out of necessity, people are finding that cosmetic procedures benefit them in the workforce, allowing them to be more competitive and appealing in the job market. There are life-saving health benefits to be obtained from certain cosmetic procedures. A woman who has been diagnosed with breast cancer can have the lump or breast removed to extend her life expectancy. After the mass or breast is removed, reconstructive surgery can help the woman have a new outlook on life. Obese patients can receive liposuction to lower their blood pressure, improve their life expectancy and health. Life-saving benefits obtained through cosmetic surgery give many patients a healthier chance at life. There are pros and cons for every cosmetic procedure, and in most cases the pros outweigh the cons, if not taken to the extreme. It is the patient's responsibility and right to know what the procedure involves. The decision should be based on educated information gathered from several sources, thus allowing the patient to make a smart decision based on their individual needs. Cosmetic surgery is not for everyone, and many supporters believe that it should be used sparingly unless being used in a situation that calls for several procedures to obtain the final goal. Procedures from cosmetic surgery allow some patients to have extended lives while allowing others to obtain a self-confidence they never had before. Patients must use extreme wisdom when making this potentially life-altering decision to have cosmetic surgery. Thank you for listening, and I hope that this speech will persuade my listeners to use cosmetic surgery with caution.